Professor Dr. Mahipal Sachdev, Chairman and Medical Director of Center for Sight Group of Eye Hospitals. Now, to answer your question as to what are the challenges for the healthcare sector in India today, I would say the basic challenge starts from the first ingredient that is required for any service industry, and that is the availability of skilled manpower. Whenever you are doing a healthcare dispensation, you need trained good people, whether it is the medical people or the paramedical staff, the ancillary staff, they need to be trained and they need to give a standard of care to the patients which is as good as in any developed country. So we don't have enough training institutions, and even if we have training institutions, the standardization of the care that is there in these training institutions is very, very poor. A person, say, graduating or post-graduating from an All India Institute of Medical Sciences would be at a different level from somebody who is graduating from another tier 3 city with a medical college which has limited infrastructure. So trained skilled manpower is the first issue. The second issue is the easy availability of land, whether it be on leasehold or whether it be on a purchase basis, because the government has just not provided adequate spaces which are earmarked for hospitals or nursing homes or single specialty centers. The third issue is the recognition that the break-evens in healthcare are rather delayed, and the government not proposing any subsidies for this particular specialty to be built, because one thing is very clear, that if the healthcare standards of India improve, the longevity of a person improves, as also the quality of life improves, and if the quality of life improves, this can easily add on to the GDP growth of a nation. Apart from that, what I would say is one of the biggest challenges that has emerged over the last couple of years is the bashing of the medical profession, because the medical profession is a soft target. So today it is synonymous to something bad that has been created by the political world or the media, and I think we need to rectify this, because the healthcare segment under severe constraints is doing an excellent yeoman service to the entire nation of India and to the healthcare delivery. See, the initiative is good because whenever there is a situation which according to me is very precarious, there has to be advocacy. So the healthcare summit, the leadership forum that is there, is this should actually work, develop ideas and do brainstorming, and then engage the government and the policy makers with advocacy, with solid reports, maybe get third party, the big four, to do certain studies, to do like we from the All India Ophthalmological Society did as to what should be their costing for a cataract surgery, how much does it cost in an individual single setup, etc., etc., and give them facts and figures that you cannot make arbitrary decisions which are not according to the ground realities. So that is what the leadership forum has to do, that they have to do an advocacy, they have to bring out white papers, they have to bring out studies, and they need to constantly have a media interaction. I think that is also very, very important, and the public needs to be on our side, that what we are doing today as providing so low cost healthcare at an excellent outcome rate. That means that in India, if you spend 10 rupees, in the US you would be spending 100 rupees for the same thing. That is something that needs to be patted on the back, and you need to create a positive environment. Today there is a negative environment for the healthcare providers, and that need to be converted into a positive environment. Let everybody make their investments in a sound manner, and there should be an above board income that the person should get, so that the returns are justified for the investment. Thank you very much.